Kathy and Jamie and Becky, do you want to come up? Dave, are you going to get a flu shot this morning?
I've been working on it.
All right, excellent. Okay, Kathy, would you like to start off?
Good morning, Mr. Chair and Commissioners. I'll just pull this up real quick. Microphone. Okay. So you all have the handouts about our case counts, both in Clay County and in Cass County. So our number of active cases in Clay County went up from last week. It was 310, and we're now at 375. Our active cases in Minnesota also went up 21,909 to 24,587. So we're still seeing the increase. So obviously we haven't hit our peak yet. In North Dakota and Cass County is 755 from the week before, and then 707. So they're seeing now a little bit of a decline. They went up previous to us in Clay County. So, and that's again just this week. It can change, as Becky always states, week to week. So we can see a decrease, but they may have an increase next week. We don't know how to. It's an unpredictable number. And then the active cases in North Dakota also went down, 3912, and then this week it's 3736. And then we have our active cases by age group. So as you can see, that 35 to 39 now is 48, and then it's the 30 to 34, and then the younger age groups again that we've been seeing, 5 to 9, 10 to 14, the 25 to 29. So we're still seeing in that younger age category. Then the cumulative cases by age, and our total number of cases is 9,934. So again, went up, and cumulatively, it's that 20 to 24 age group that's at the highest, followed by the 30 to 34, and then the 15 to 19 age group. And then our Clay County cases per week from July through current. So you can see how we've had an increase in our cases per week. And then that is the overview from March of 2020 to current. So you can clearly see that we're in our fourth wave of cases, and we have surpassed the number of cases seen at the same time last year. Okay, Becky.
Good morning. So this graph again depicts the number of Clay County deaths reported by week. We did unfortunately have another death reported in Clay County since last week. So our total number of deaths for the county is at 98. And then this graph depicts the number of COVID hospital admissions for Clay County residents per week. We have seen a bit of a decrease in the number of admissions over the past couple weeks, so that's good news. We do typically see a rise in hospitalizations 2 to 3 weeks after we see a rise in cases, so I wouldn't be, overly surprised to see another uptick of hospitalizations over the next couple weeks. And then this slide breaks down the recent hospitalizations, so from August 1st until current, of Clay County residents by age. So as you can see by the pie chart on the left, the majority, 66% of those that are admitted to the hospital are under the age of 65. And then the bar graph on the right shows the breakdown of admissions by each specific age group. So the 4 new admissions that we've had since last week have been in the 30 to 34 age group and 60 to 69 age groups. And we do actually now have hospital capacity information for our local hospital systems. So in Fargo, which includes Essentia, Sanford, and the VA. So the first two columns on this chart show the number of available ICU and non-ICU beds for adults. The last two columns are specific to pediatric bed capacity, both ICU and non-ICU. So you can see as of Sunday, Essentia had 0 adult beds available, both ICU and non-ICU, 2 pediatric ICU beds available, and 1 pediatric non-ICU bed available. Sanford had 7 adult ICU beds available and 2 non-ICU beds available, 1 pediatric ICU bed, and 4 pediatric non-ICU beds available. And then the VA, as of the 7th, their data lags a little bit with reporting, had 2 ICU beds and 3 non-ICU beds available.
Go ahead, Commissioner Wood.
Thank you. Thank you for getting the hospital capacity information. We've really been wanting this to help us get a full picture. Are you hearing from the hospitals in terms of elective surgeries? Are they holding off on those? Have they taken steps to slow those admissions in anticipation of ICU and COVID needs?
Guess I'm not sure. Kathy.
Yeah, we will have a meeting with the healthcare systems on Thursday, so I suspect they'll let us know what they're seeing. We haven't heard anything this week at all.
Thank you. And any further information in terms of setting up beds at an off-site, as we saw before at the Fargo Dome?
No, we haven't heard anything about that as it's at this time. So we have weekly meetings now set up, so we'll maybe hear more information.
Thank you.
Okay.
And then this slide shows statewide hospitalization data for North Dakota as of yesterday. So there's currently 211 hospitalized due to COVID throughout the state of North Dakota, with 24 in the ICU. So last week, the number of hospitalized was at 157, so that number has gone up. The number in the ICU has, however, remained the same at 24. The chart in the middle shows current hospitalizations broken down by age. So there's currently 4 pediatric admissions. The chart on the right shows age groups of the total admissions throughout the pandemic. And then just a note that the number of COVID admissions in North Dakota right now are at the highest they've been since last December. So for comparison, at the peak of our fall 2020 surge, there were 332 hospitalized, and we're at 211 now. And then this graphic is the graphic put out by the Sanford Health System that we show every week. And so it's updated as of October 5th. The red people, again, represent those that are not vaccinated, and the white represent those that are. The overwhelming majority of hospitalized cases continue to be among the unvaccinated. So you can see 31 of the 32 patients on ventilators are currently not vaccinated. And these are patients across all of Sanford hospitals, not just in Fargo, but by using more numbers, that really helps to show, a more consistent trend across the board. All right, and then our breakthrough cases. These numbers are updated weekly by by Minnesota Department of Health. Our breakthrough infections have gone up a little bit from last week, so we're at 1.210%. Breakthrough hospitalizations still very low at 0.06%, and breakthrough deaths even lower at 0.007%.
Becky, I want to talk about that for a minute. When these vaccines came out, was it a year ago in February, I think? Was that about, Kathy, is that about when they started? January and February and
Yes.
And there was a catch-up period for everybody to get them. But back when those vaccines were first talked about, for Pfizer was the first one approved, and they said that it would have an effective rate somewhere around, I thought it was like 93%. So it seems to me that of those vaccinated, and we talk about breakthrough cases, even though there's some people that seem to be worried about it, it almost seems like the vaccines are even working better than what they originally described, because this is nowhere near 7% or 6% or even 5%. So, I hope I'm you're understanding what I'm saying here. It seems to me that these vaccines are even working at a higher percentage rate than anticipated based on the breakthrough. Breakthrough cases just means that they have COVID after being fully vaccinated. And we were told at the time these vaccines came out that their effectiveness was somewhere in the mid-90s, right? Am I correct in that?
That's correct.
So, you know, just to point that out, that it's, although it's alarming when we see somebody that gets it after being already vaccinated, but the breakthrough hospitalizations is also right where they said it would be.
Right.
And the same with the, you know, they talked to almost 100% from deaths. And, I mean, we're at 99.997% effectiveness, according to this, in Minnesota, from deaths. So I think it's, to me, it's a positive sign that that those vaccines are even working better than originally thought.
Right.
Okay. I've said my piece.
Okay, thank you. Okay, we'll go on to the next slide, which is the administration and distribution of data for Minnesota vaccines. This is across Minnesota. So the people with at least one dose of vaccine, we're at 72.8% in Minnesota now, so continue to climb. And the people with the completed vaccine series is 69.2% in Minnesota. And then we see the breakdown of the by age and the individuals that have completed the full series or had one vaccine on the bottom there. Continue to see that 65 plus is the highest percentage of vaccinated individuals. And then we can go to the next slide and we'll look at what. Yep.
Jamie, can I, on those percentages, are those percentages based on those eligible, of the eligible population for the
Yes.
vaccine?
So in this case, it's the 12 and over. That's who we're looking at.
Okay.
So the data has jumped around a little bit because we were at 18 and over, and so
Right.
now we're down at the 12. So that is everyone who's eligible at this time. And then looking at the Clay County clinics and the doses we've provided since the beginning of providing vaccine in January, it's 15,614 doses. And it was just 27 doses last week. I think last week was our till 6 p.m. clinic, so we keep rotating those over lunch hour and in the evenings. And the response has been pretty minimal. We're focusing on first and second doses. This last week, Minnesota Department of Health finished the protocol for boosters, so we are going to start boosters this week. But again, Minnesota Department of Health continues to say they would like local public health to focus on finding those vulnerable populations and providing the first and second doses, so we will do that as well. And then Commissioner Ebinger mentioned the opportunities for vaccine in our community are great. There is an opportunity for a booster for people that are looking for that. And so what we do is we continue to share with people that are calling where they can be vaccinated, our pharmacies and our healthcare systems as well as us. Last week we did first and second doses. This week what we're planning, we have a clinic on Thursday and Friday. And so we'll be offering Pfizer vaccine for anyone age 12 and over, Johnson & Johnson, we continue to have that for ages 18 and over. We're offering first doses, second doses, and booster doses as well. We do have some Moderna vaccine. We're not doing a lot of that because the requests are very minimal, like 1 or 2 doses, and we've got a bottle of 13, 14 doses. And so instead of waste that, we redirect them to the pharmacies that are accepting walk-in clinics.
Commissioner Mojo.
Thank you. I possibly have said this before, so I apologize if it's redundant, but last week I again was at one of our local drugstores picking some things up, and several people had come up and wanted to have their COVID vaccine. For whatever reason, they didn't have it, whether it be Pfizer, whatever one they needed or wanted, and said, oh, just check the website of so-and-so pharmacy. And I say that because I think that's frustrating for people that are finally at a point where they're either off work or at a location and they want to get the vaccine, and then it seems like there has to be this runaround. When my boys were ready to get it, we went to several different and we made it work, but I feel like there are people that are just going to get frustrated with that process and say, forget it, or they'll call Clay County Public Health and it's 5 o'clock and it's not a night of a vaccine clinic, and so they say, forget it. So is there a way that we could coordinate better with some of those pharmacies? Or, you know, I've said before, I drove out to see my niece, and in Jamestown on the corner was their county public health department under a tent giving vaccinations. Have we, I know you're working like crazy, and have we thought outside the box on that piece? Because I know you have more doses available than just the 27. And coming from someone who has had a carload of kids trying to find a vaccine location, that's stressful, and sometimes people just say, forget it. What can we do?
So a couple things. The biggest challenge for us nationwide is those doses that we're all trying not to waste. And so what I did is called our local pharmacies to find out who are you accepting for walk-ins. And so we can update that again, because that's what we're doing, is saying if you go to CVS, you can get a Pfizer or Moderna. So we're directing them to the ones that are saying we'll take walk-ins, because those are the people that you're talking about. We are trying to make it as easy as we can. For our clinics, we have we're overstaffed for the clinics on anticipating the numbers that are not coming in. We do use a couple of things. We use the register online. We've done a QR code on site so they can actually come and register there. So, you know, I guess when you talk about the tent, we haven't done that, except we did do that at our universities. So we went to each of them and we did that same, and our numbers were low as well. But we keep trying to figure out, the challenge is the frustration of people just, it's not like a flu bottle. We can just give you flu vaccine and put it back in the refrigerator. It's that wasted dose thing that we're struggling with as a nation. And so we continue to try to make it as easy as possible, but we will definitely go through that list of pharmacies again.
Well, and I'm not saying that I want you sitting on the corner now that it's getting cold. I'm just trying to think creatively. I mean, we have a DMV at the Moorhead Center Mall with a lot of people that come in and out. And for instance, when we were doing the flu shots here, I think somebody that hadn't planned on getting a flu shot saw it was available and just did it. So maybe it means we set a site up at the DMV, and folks coming through could stop and do that. I don't know.
Time to do that where people are. Well, we will definitely talk about that, our planning team, and see how we can do that as well. The other thing, just to share with you, we are also planning, we're gearing up for flu clinics now, so we're doing both COVID and flu at the same time, and we've gone to a couple of our senior centers. We're going to be inviting our county employees this week for clinics on Thursday and Friday. And then we'll continue to work with our partners, seniors, and other businesses that we routinely vaccinate for flu, but we're trying to provide both opportunities at the same time. So that will be during our clinics. That will be this Thursday at the Family Service Center, 10 to 2 on Thursday and 9 to 1 on Friday will be our clinics. And then just to kind of share with you, the Saliva Testing site in Moorhead continues to be open. Minnesota continues to stress how easy it is. I saw there was an article in the Inforum as well, you know, highlighting that it can be easy and quick to test. We had as the week of September 26th, we had an 8.6% positivity rate, and then the number of tests conducted for the week was 805. So we're seeing a climb. But again, we're a little bit spoiled in terms of our response rate in this community, and people are frustrated with they're not getting their results back in 24 hours. So we've asked for an additional day, and our clinic is now, the Saliva Vault testing site is now open on Sundays as well. I don't remember the hours, do you guys?
Do you think Jamie, do you think there's a difference now in people going to get these rapid tests? You think there's a difference now versus a year ago, where people a year ago just might have wanted to know if they had it or not, because there's so many uncertainties about the people being asymptomatic and that type of thing, versus now maybe is it more people who are suspicious that they might have it versus just wanting to know if they have it?
Yes.
Maybe that could be why our positivity rate is higher, because
We're picking up.
based on those that are being tested.
And we are encouraging people, if they're, attending big events, they should test. So at that time, we were just saying, if you've been exposed or you have symptoms, go get tests, because we were overwhelmed with testing, but
Because we
are
used to have like
encouraging.
1,500 tests.
Yes.
Yes, exactly. But yes, we are encouraging people, if you've been to an event and you want to get tested, do that. There's a lot more requirements for testing for employees and for travel without symptoms, so we're picking up those without.
Anything else, Jamie, for your? Anything else for, so we also have on here to review the COVID-19 mitigation strategies and masks, that fun topic. We talked yesterday at one of our meetings, and we would like to review this still on a weekly basis to see where we're going and what the indications are, what's happening within our own campuses. And if we're seeing any troubling signs or signs of improvement that are going on, and are there changes to mitigation strategies, and I guess Kathy, we kind of look to you for that too, for what your thoughts are.
Yeah, based on the numbers and as we follow this week to week, we haven't completed the surge for our fourth wave. So it would be unlikely that, this would be an appropriate time. Once we see the decline is what we're looking for. So the number of cases and also decline in across Clay County and in Minnesota. And then as Becky reviews all of the hospitalization data, we also look at that, what's happening in our community for our hospitals, surge in capacity. So because the numbers are still climbing, it probably is not warranted at this point in time.
What are you?
Change our policy.
What are you hearing over at, I'm particularly talking about the Family Service Center now, because, during the higher episodes of this, we also had that person at the front, and I think that person just made sure that everybody coming in was masked and doing their thing, and that's no longer there. So I'm just wondering if, what we're seeing there, and in terms of the public coming in there, are they following along with what we need to have done?
Well, we don't have, Mr. Chair, we don't have the security individual, but we do have an individual that's at the front all the time, every day of the week. And she's posted there, and she certainly will tell people that, if they don't have a mask, that masks are required. And we also have it on the door as well, but she's there every day, Monday through Friday. She sits in that corner office, so she's kind of keeping tabs on that, so.
What happens if we have somebody comes in and they don't have, and they just...
Well, usually if they're coming in, they're coming in, all of the entities in the Family Service Center building now, even tenants are requiring masks. So if they're coming up to the Workforce Center, they require masks. So they'll ensure that they get them a mask. They're coming in for public health or social services, we ensure that they have a mask. And the dental office has required masks the whole time. And CAP LP, as Commissioner Mojo mentioned, they're requiring masks. So everybody is requiring a mask. So in order to get into the offices, they need to have a mask on.
Okay. All right. So I guess the message from you is just,
Another week.
yeah, Commissioner Mojo?
I appreciate, your referral, Kathy. I think my questions that I posed last time we talked about this was what our policy as a county looks like. What does it look like? Is it 100% what public health recommendation is? Does it look at percent positive within employees? Does it look at vaccination rates within employees? I know that I had attended the PIC committee, and we talked a little bit about that to make sure we sent that survey out for staff. I had Darren go back and look at what staff positivity numbers look like over the last 18 months, and so he was able to basically get out anytime we had employees that were sick out with COVID, so we have the percent infected of that. You know, I'd like to have a solid policy that takes all of the 5 or 6 data sets that we can look at as a benchmark, so we know what a policy looks like going forward. And I am not quite sure we still have not created something like that. And I'm not really looking at you so much as our, administration and HR. I think we need to have something solid so that we're not grasping numbers that may look back at as inconsistent. I want us to be as consistent as possible. So certainly, I think that that's something we need to do. Secondly, we have an ARPA committee that has funds available that we've used in the first round of CARES to make sure that we had sets in place that protected staff, protected the public, had barriers and all of those parameters in place. And we've not had any more requests from departments on how to make areas safer. And if we're going to masks, that's telling me that we've not necessarily done the best we can to make sure that staff and the public are safe in terms of having their business taken care of. So I would encourage our departments to look at that and see if there's any other ways we can help to improve these transactions to make them safer.
So, Mr. Chair and Commissioner Mojo, they did do all of the plexiglass, at front desks. The reason why masking is still, the plexiglass doesn't take the place of masking, nor masking take the place of the plexiglass barriers. Those are the front desk people that are just interacting initially with the people, but we're doing a lot of face-to-face, and when we do that, we have to have masks on, both with the persons that we're serving and then our staff, because, we're meeting them in various areas where plexiglass is not available or would not make sense. So it's kind of the combination of both. And as someone with the epidemiology background, Becky talks about, we have to look at everything that we're providing. So we're looking at what's happening in our community. That's a benchmark. What's happening in Clay County, what's happening in Minnesota. It's not just so much what's happening with our employees, although important or interesting to know, but our people are going out into the communities and out doing other events. So really we're protecting the whole, well, by our mitigation measures, at least we're protecting for when they come back from all their events or when they're going out to all their events. So it's a combination of all of those factors that we're taking into account. And Becky, maybe you could add to that if you want to talk about what Commissioner Mojo question about, what factors are we looking at?
Yeah, I think it's important to look at the whole picture, community-wide, not just building-wide or county-wide. Looking at our community spread right now is extremely high, so the CDC would recommend indoor masking. Our employees are going in and out, they go home at night, they're intermingling with family, friends, other social events, and then coming back here. So I guess I would caution against just using our numbers internally. I think we need to look at the whole picture, at our hospital capacity, and then also our numbers.
And I understand that, and I appreciate that, but I have a hard time when so many members of our communities are filling stadiums and amphitheaters. And, I understand that our numbers are going up, but to me, it seems like our vaccination has also done its job because people are out and about more and at the schools and et cetera. So I just, I understand the position of the board may be, but I think I still encourage our departments to look to see how we can make things safer as we move out of COVID, whatever that looks like.
Maybe a follow-up to that, and I know, Steve, you have your management meetings a lot, and I guess, how often do you have those? Is that?
We meet every other week, Mr. Chair.
And I guess I think that should still be a good topic to get feedback from management, you know, as part of your meeting and what's working and what isn't and because we want to beat this and get out of this as quickly as we can. And you know, I hear some employees are frustrated with our policy as well, and I think we just need to find a solution quickly. Okay, so we'll be back, you'll be back next week, and I don't think we're in a position to, I know that your original motion was to relook at this in 2 weeks, and I think that's today, and I don't think, based on public health's recommendations, I don't know that this is the time to adjust that. So we'll look at next week again. We'll
Okay,
keep this up, and hopefully those numbers will start trending down like they are nationwide, and we can see some improvement.
That's certainly our hope.
Okay. Any other questions for public health? Yes,
I
Commissioner.
do have one question. So you just said, you know, when the numbers start trending down, but when we look at the numbers, they do kind of go up and down a little bit. I guess I personally would like them to see them going consistently down for at least some period of time, because we might have 1 week where it looks lower and then it goes back up again. So something to keep in mind.
I thought I used the word trend, but maybe I didn't. Okay, thank you.
Okay, thank you.